Welcome to Roadmap to Residency Evidence-Based Application. In this video, we will be discussing about drug elimination, the cytochromes, the renal elimination, the phase 1 and phase 2 reactions. Pharmacokinetics, that is the drug elimination. So out of body, it is called as excretion. The major routes are kidney and liver. Through kidney via urine and through liver via bile and feces. Or it can also get excreted through inhalants like lungs exhale air, and least commonly via saliva, milk, sweat, keratin, that is in hair, nails, or hooves. Factors that are responsible for altering this drug elimination are dehydration and age-related degeneration of kidney or liver, or you can say renal failure or liver failure. So pharmacokinetics of renal elimination. So renal elimination of drug involves glomerular filtration, which is a passive process. The renal arteriole changes into capillaries, which then forms glomerulus. In the nephron, that is Bowman's capsule, the blood, protein in, and water or drugs are then thrown out. Again, after that, there is the tubular reabsorption, that is also a passive diffusion process, and tubular secretion, which is an active process. Now, I have discussed in detail about this renal elimination of drugs in our nephrology module, so you can go and see that. Now, pharmacokinetics of renal elimination to be continued. So the proximal convoluted tubule have active transport of glucose and drugs, which are essentials. The secretion, example, penicillin is actively secreted in the PCD. The loop of Henle, here there is action of lipophilic drugs, the urinary acidifiers, and alkalizing drugs. Blood pressure is a factor which decreases the filtration. So if the filtration is decreased, then there is decreased elimination. The urine pH can also affect the rate of drug excretion. That is, weak acids gets better excreted in the basic urine, and weak bases gets better excreted in the acidic urine. Dehydration, blood loss, salt, and increasing in the sympathetic activity, they all have an effect in the renal elimination of the drug. Now, talking about in liver failure, the hypoalbuminemia and hypoproteinemia that occur. So, albumin is the number one transferred protein in circulation and is made in the liver. Animals or we humans with liver disease will have less protein in the body. Thus, more drug will be unbound and available to the tissues. The decreased dosages or different medications should be chosen for patients with liver disease. Also important because most drugs will be metabolized by the liver. Now we have talked about the dose adjustment of the different drugs in different conditions in our different modules. So the hepatic elimination or biliary excretion, the drugs are secreted, that is passive diffusion into the bile. The bile is secreted into the duodenum, where the lipophilic form gets into the liver, and from the liver it gets into the systemic circulation. The lipophilic drugs then re-enter the bloodstream and eventually return to the liver. The hydrophilic drugs get eliminated in the feces. In enterohepatic circulation, that is from liver to GI tract through back to the liver, there is increased duration of drug in the body. And hepatic lipidosis or cirrhosis, in these cases, the drug dose should be reduced because of that. Now, talking about drug elimination terminology, so what is drug residue? So the amount of drug that can be detected in tissues after administration ceases is called as drug residue. Withdrawal time is a period of time after drug administration during which the animal or the humans cannot be sent to market for slaughter and the eggs of meat. Now let's talk about phase 1 and 2 biotransformation. So phase 1 is when we add or expose the functional groups on parent molecules. The elderly population, they lose the phase 1. So there is loss of pharmacological activity. Sometimes it can also increase the activity in case of prodrugs. Now, in the smooth endoplasmic reticulum, there is cytochrome P450 family, or we can say CYP enzymes. Now, due to the effect of these enzymes, there are different drug interactions. Either the drug may be inhibited or it may be induced. So phase 2 is the biosynthetic reaction. There is covalent linkage with various molecules. For example, glucuronic acid, sulfate, glutathione, amino acids, acetate, they also phase 2 reaction. So there is mostly cytosolic localization and it may precede phase 1 reactions with some drugs. Okay, so from phase 1 and then there is the phase 2. You can see in this diagram. So whenever we prescribe a drug, then if the drug is hydrophilic, will directly get excreted throughout the kidney. But if it is lipophilic, it will undergo metabolism. Okay. Now, the phase one reaction is when the drug undergoes oxidation, hydrolysis, or reduction, and then it forms a metabolite. Okay, that is also called as metabolism A. Okay, that is the first metabolite product. Now, this metabolite can either go towards the phase two reaction, which is a conjugation reaction, or they can ultimately form a second metabolite, that is metabolite 2, and can get excreted through urine and bile. The only concept about phase 1 and phase 2 reaction is that the drug undergoes specific reaction to form active metabolite. If it is a lipophilic drug, if it is a hydrophilic drug, it will get excreted through the kidney there and there only. Now, this is a very simple concept. Some resources make it very, very complex, but the only thing to understand is that when we prescribe a drug, there is phase one reaction, which is the drug undergoes a series of reactions of oxidation, hydrolysis, and reduction. You need to know this name. What are the reactions that are occurring in phase one? And it forms a metabolite, that is metabolite A. Now, this metabolite either can go towards phase two, or either can form a metabolite 2 and can get excreted through urine and bile. Also, some drug can directly go through a phase two reactions and form a metabolite B. Now, let's talk about one question here. So, which of the following best describes the pharmacokinetic phase during which the cytochrome P450 mediated metabolism of the arthritis medication primarily occurs? A 68-year-old man with a history of hypertension and type 2 diabetes mellitus presents to his primary care physician for a routine follow-up appointment. His current medications include metoprolol for hypertension and metformin for diabetes. During the visit, the patient mentions that he has recently been prescribed a new medication for arthritis. The physician reviews the patient's medication list and notes that the new arthritis medication is metabolized primarily by cytochrome P450 enzymes in the liver. Now, which of the following best describes the pharmacokinetic phase during which the cytochrome P450 mediated metabolism of the arthritis medication primarily occurs? Absorption, distribution, metabolism, excretion, or elimination. So yeah, elimination. Sorry, metabolism. So in pharmacokinetics, the drug metabolism refers to the enzymatic biotransformation of drugs into metabolites, which are typically more hydrophilic and easier to excrete from the body. Metabolism is one of the key phases that determine the fate of drugs in the body, along with absorption, distribution, and excretion. The CYP enzymes, located primarily in the liver but also present in other tissues, play a crucial role in the metabolism of a wide range of drugs. Now, these enzymes catalyze phase 1 reactions, which involve various oxidative, reductive, and hydrolytic processes to modify the chemical structure of drugs. Now, the phase 1 metabolism reactions often introduce or unmax the functional group, such as hydroxyl, carboxyl, or amino groups, rendering the drug more polar and facilitate subsequent elimination. Now, in the clinical vignette that we have, the patient's new arthritis medication is metabolized primarily by cytochrome P450 enzymes in the liver. Therefore, the phase during which the cytochrome P450 mediated metabolism of the arthritis medication primarily occurs is the metabolism phase. That is option C. Okay. Now you know about phase 1 reaction. Now, a 45-year-old woman with a history of chronic back pain presents to a physician for a follow-up appointment. Now, she has been taking tramadol, which is an opioid analgesic for pain management. During the visit, the physician decides to switch her medication to acetaminophen due to concerns about opioid-related side effect. Acetaminophen is primarily metabolized by conjugation reactions in the liver. Now, which of the following best describes the pharmacokinetic phase during which the conjugation metabolism of acetaminophen primarily occurs? Yes, you know metabolism, but what I want you to know in this vignette is that the conjugation metabolism, also known as phase 2 metabolism, involves the addition of functional groups to drugs or their metabolites, resulting in decreased water solubility and enhanced excretion. Phase 2 reactions typically follow phase 1 reactions and further metabolize the drugs to facilitate their elimination from the body. Now, acetaminophen is primarily metabolized by phase 2 conjugation reactions in the liver. The predominant pathway involves glucuronidation, where acetaminophen is conjugated with glucuronic acid to form the highly water-soluble metabolite, acetaminophen glucuronide. Now, this conjugate is then excreted in the urine. Now you know what happens in phase 1 and phase 2 reactions. The main motto of this video was to make you oriented about the phase 1 and phase 2 reactions. Now, in your first aid, there are list of the drugs which induces the cytochrome P450 and which inhibits the cytochrome P450. You need to learn those drugs by heart. Thank you for watching. Keep studying hard.